We're just interested in one or two things there.
Okay, we're going to go live here, guys.
I think we have to go to work. We'll talk after.
Yeah.
Grab it. Grab it.
That's what I have to do.
Yeah. And then, perfect. You're live. Okay, we're live.
Good.
Hot mic. Have a good meeting. Thank you, Nicole.
Thanks, Nicole.
It's up there next to Mike.
And then,
Before they go get surgery.
yeah.
I couldn't lift it, sorry.
Good, how are you?
Call the Board of Health meeting at 1 o'clock to order. So open up with public comment. Is there any public comment? I don't see any. Okay.
Does everybody have an agenda?
Okay, so we'll go with COVID-19 plans, COVID-19 update.
I'll give a quick COVID-19 update. We really don't have much to talk about today in terms of plans, because we're no longer reviewing plans. I think there was some confusion out in the community about the FFA event that occurred recently. There were some posts on Facebook saying, why didn't they get to have their dinner? That was all dealt with earlier in, that event was reviewed by you all when we were still under the guidance. And the FFA decided, it's my understanding, they decided not to change the event suddenly based on the new regulations. To put something like that on takes time and effort, and they didn't have the personnel to help with that. So
Sure.
I think there's some misconception about that we had not allowed it. And we are getting calls on a regular basis about hosting events or having events in the community. And we are telling them, or I am telling them, folks, that there are no regulations on events, but it's still important to try to follow CDC guidelines. And so that's something that that's up to them as an event to do. But we are not, limiting any type of community activities at this point. So I think that's really the that part of the COVID update. There will be some update from Teresa. She gave me her notes, and then I think maybe we'll have a little discussion about the, can talk about the event that happened last Thursday, and then the one that's coming up in a few weeks, maybe, or something.
I've got all that information.
We'll talk about that maybe under new business. So really, nothing too exciting going on. That's good on that part. So.
Okay, let's see, our public health officer's not here, so we'll go to the public health nurse report.
Okay, I am speaking for Teresa today for the old business, and I can't necessarily respond to any of her comments if there are questions. But she said in response to Mr. Ravindal on the 10 essential functions of public health, these duties are clearly written in Article 3, Section 1, Part A. And then she said that she spoke with George Marsuzzi. He stated the stairway was inspected by Kevin McDonald and was safe. He will put a sign up that says no trespassing. On Sunday, the no trespassing sign was put up. So that must be regarding the building across the street there. So, okay. And that's all I have for old business for Teresa.
Yeah. Report from Board of Health members, Leota Gromley, COVID vaccine clinic update and future plans.
Okay, so we did have a vaccine clinic last Thursday, the 8th. We vaccinated a total of 477 people. About 60 of those were for their second dose. Things went well. We had lots of great comments and lots of positive comments. We want to thank everyone who helped and donated food. DES helped us quite a bit getting set up. And Teresa came over for a couple hours. And we also want to thank the Board of Health members that were able to come over and take a look and see how the operation was going too. So our next clinic is actually going to be next Friday, the 26th of March. Still out at the fairgrounds, and I do have some flyers. I'll pass these down to you guys. And then I have some flyers if anyone wants to take some. It will be from 9 a.m. to approximately 4 p.m. And we will have approximately 500 vaccinations that we can do first dosers with. So, so that's exciting. And we're working with Teresa. She's actually gonna, she's got some vaccine that she's gonna share with us. So, and also we will be doing one on the 8th of April, and that would be for the people from March who got their first dose for their second dose. And there is the possibility of having some first dosers there too. So.
What was the first date?
The first date is March 26th, and I'm passed out a flyer there, which has all the information. It's the same way that people registered for the first dose, so nothing changed except the date.
Great.
So from 9 a.m. till approximately 4 p.m. And that should be, the website should be active sometime today. We're working on that right now. So, very exciting. Nice to get things going. So.
The governor changed so that starting in April, 16-year-olds and older can then be.
Well,
Is that how it is?
that 16 is only for Pfizer. Moderna doesn't go under 18.
Oh, okay.
And that's the only one we have.
Okay.
And County Health has the Moderna, and they also have the Johnson & Johnson. And I don't remember what the age on that one is.
Okay.
I think it's still 18.
Got it. Okay.
So yeah, that's going to open things wide open.
Yeah, good.
So we are finding doing the clinics instead of doing, every day is a lot more efficient. We get more done in less time. And so we're going to try and be able to continue to do that as much as we can, because it gets it knocked out really fast.
So do you know how many shots will you get for the one on the 26th? Will you get 400
approximately
again?
500. Approximately.
500?
No, 500.
500,
500.
okay.
Sorry, the mask. So, yeah.
Is that a combination between?
No,
you
it's
and the county?
yeah. The county's giving us. Can't remember if it was 120 or 180. But
And
yeah,
then you guys have the other 300
yeah.
or so? Wow.
We have 200 on hand, I believe, and we'll get another 100 next week. So, yeah, we should have that. So, yes.
So then I guess on the 8th of April, then you're gonna have to do at least another 500 to get
Well,
700 people?
60, about 420 were first dosers.
Right.
So, and those will automatically get those shipped to us.
Mm-hmm.
And then we're still getting a weekly allotment between us and County Health, and so we'll just kind of see how that goes as to what extra we can do. If we can, we absolutely will. But we will get, we'll have all of those for their second dosers already scheduled, so when people go out, they'll only see what slots are available for the first.
Do you know on the county side, can residents come in? Is there a waiting list or stuff?
The waiting list is actually, we're kind of manning that so that and if they get some, we collaborate all the
Yeah.
time with them. But they can call the 406-603-4524 phone number if they want to be put on the list.
So as far as county residents going over to the county health department to get one, they can't do that?
Yes, I know the county health is still doing
Oh,
them
they
on
are,
a
okay.
daily basis.
Okay, I gotcha.
I don't know what their schedule is,
Yeah,
but they can
yeah,
reach out there if they
yeah.
can't wait or these dates don't
Yeah,
work.
work out, yeah, I gotcha.
Thank you. Good thought. So.
So are you requiring, are these only in-county residents, or is it anyone that shows up?
Broadwater County.
Oh, okay, okay.
I will say I went down there that day to see it, and it was so organized. It was, and I don't remember what time of day it was, middle of the day, I guess.
Mm-hmm.
Very organized. People had their timers. They were sitting. They were happy.
Yeah. Well, we started with this. We started doing 20 every 20 minutes because we didn't know what we could handle, and we figure we can probably do 30 every 20 minutes, 25 to 30. I think this next time we're going to do 25. See how that works, and maybe find a good number that will work. So.
Well, congratulations, because it was well done.
It was a lot of hands in that. So thank you.
I'm still surprised at the number of people that don't want to get it.
Yeah.
Thanks, Leota.
Yeah,
Anybody
you're
else have
welcome.
anything? Let's see, the next is the Board of Health minutes for approval for the minutes for Wednesday, February 24th.
Does anybody need a copy of the minutes?
I didn't get them.
Fine.
Were they updated again, or?
These are from the 24th.
Yeah, that's.
Oh, okay, I saw, yeah, I thought she had some changes.
Yeah, this, I've got it.
Yeah.
Yeah.
Yeah, these are old.
Yeah.
These are old.
Mhm.
These are what she sent out. So
Oh, yeah, she sent me a different thing. Okay.
Yeah, I had sent some corrections, and my
Yeah, I
corrections were just misspellings of names.
Yeah.
But they're
Okay.
still incorrect on
Okay.
here, so, but that's all it was, that I saw.
Okay, well, we can get those cleaned up, and then if there are any other comments.
So we'll wait till we get the corrected edition of minutes to
Is
approve.
that what you want to do? Okay.
Yeah, to review it.
Mhm.
Okay.
Okay, County Sanitary and Cooperative Agreement.
So we had sent out for one of the previous, when we didn't have a quorum, I'd sent out the cooperative agreement, which is the agreement between the Department of Health and Human Services and the county for the food inspections, licensed establishments like trailer parks, campgrounds, and that type of thing. And if you don't have it, I should have sent it out in the email, but this is a copy of the cooperative agreement. And, I mean, this is the same agreement that we do every year with the Department of Health and Human Services for the county to get reimbursed for the inspections that we do. And we did do an amendment, if you remember, last year, they allowed us to include all of our COVID interactions with the licensed establishments so that we weren't doing normal inspections last year because we were spending all of our time working with the establishments to figure out how to deal with the COVID. So they allowed us to use that time for the reimbursement. Now we're moving back to the normal license or agreement that we have had in the past. If you would like, we can, we're going to be bound to this at some point from January 1st through December 31st. So if you want time to take a look at it, then we can come back and revisit this, or you can take a look at it now and we can go that way, vote on it today, so. We did get I think we got the full reimbursement just last week for all of the inspection, the portion of the license that we get. It was around $8,000, so a little money to put back in the pot.
John, are you under a time frame to have this back?
I don't really think no. So if we want to wait and to allow everyone to kind of glance through it, absolutely, we can do that.
I'd appreciate it. I'm sure it's fine. I'm sure it's a good
Yeah,
thing.
yeah, no.
I just, personally, I don't know how the other members feel, but I don't feel like I'm a rubber stamper here and only have a few minutes to look at something.
No. Yeah, and I don't feel like, we don't want to do that. And
Yeah,
I'm
yeah.
going to continue doing everything
Yeah.
that I normally do. at some point we'll get it all caught up. And the food and consumer, the director understands how we're all just kind of really maybe starting to kind of catch up to.
Catch our breath.
Yeah, catch our breath.
Yeah.
Not catch up, but definitely catch our breath.
Yeah.
So, yeah, I think that's a great idea.
So we'll table this until the next meeting also? Okay, new business. You got anything for new business, Sean?
I do. Do you want me to read Teresa's or you want me to do mine right now?
Let's do yours.
Okay. So one of the things I wanted to kind of give an update is about the septic permit applications, how many I've received, kind of how it compares to years in the past. So to date, I have issued 52 drain field permits. I have 17 that are either waiting like an address, or 10 that came in today of those 17 that have everything, able to issue those. So that means I'm up to, I could potentially issue 69 permits at the end of this week. Last year at this time, we had issued 13. And then in 2017 was the highest that I saw, going back all the way to 2013. We'd done 14 permits by this time in 2014 or 2017, excuse me. So I also saw that in 2015, 2014, and 2013, I've already issued more permits than the whole year had issued. So we're seeing some just.
And those are probably growing years themselves.
Well, they should have been,
Yeah.
absolutely. The
Yeah.
recession was
Wow.
coming out.
Yeah.
People were moving, and but we're seeing truly fantastic amounts of growth, and spec homes, just everything, and it's pretty much county-wide. I would say, a majority of the growth. I'd like to say that it's all south, but there's a lot around Springville and then up in the Silos area as well. But it's any place there are lots, available. Deep Creek and those areas, just anything. So I currently have of those 52 permits that were issued this year, 44 of them haven't been installed. And last year, out of the 148 total I had issued, there's 45 that still have to be installed. So I'm looking at about close to 90 permits that are already permitted, just ready to go into the ground. And that's not even counting what I'm seeing in the phone calls. We are seeing phone calls. Or we're receiving phone calls, and Nicole's in on this too with the planning, but we're getting calls daily from realtors, daily from new homeowners or new landowners, buyers. I mean, it's the craziest I've seen here, but it's also just knowing from the other parts of work that I do, and JJ knows this too. It's just we're feeling it all over in the state. It's a land rush right now. So that's all I have for new business for me. Was just kind of an update about the septic permits, how many we're seeing. From my standpoint, I'm already mentally preparing to be available because we're going to have to do a lot of inspections, and it'll be important to make sure that they do get inspected, because we know that when there's this rush, quality goes down sometimes, and so it's even more important that now to see the inspections and that, I think so. We've been talking to, I'll just remember kind of circling back to the arsenic thing that we talked about before. The main contractors that are building spec homes have reached out and talked to them. They are already starting to sample for arsenic at the homes that they're building. The bad thing is that typically the pump doesn't get installed until pretty late in the game when it comes to the house part. They may drill the well before the house is ever put up. And ideally, they would have the well pumper give them a sample then, but they typically don't. And so then they don't figure out whether there's good water there until 30 days before the house is turned over. So I'm trying to work with everyone to do the plumbing and everything necessary so that it doesn't go into the drain field. So that's all ready to go. If they need it, they've spent maybe a couple $100 at the most to be prepared for it, but they're not going to sabotage their drain field by having this reverse osmosis discharging all that wastewater into it. So that's all I've got for playing the sanitarian.
Okay, you wanna go ahead with the public nurse?
Okay,
Got new
so-
business for her?
Yeah, so this is from Teresa, and these are from her notes from Monday. So some of the numbers may have changed because the governor has changed to some dates on when teenagers can start to get vaccinated. This is what she included. We currently have given 1,152 COVID-19 vaccines, with 382 fully vaccinated as of Saturday, March 13th. We have 7 active cases, and there have been 5 deaths in Broadwater County. We still have no cases of the flu. Last year we had 87 cases of the flu in Broadwater County, and we had 11,255 cases of flu in Montana. In partnership with Billings Clinic Broadwater, 427 vaccines were given at the fairgrounds on Thursday, March 11th. The event went very well. Another vaccine clinic is being planned for April 8th for the second doses, and around 200 new doses are planned to be given. The health department is giving Johnson & Johnson vaccinations this week. We will resume with the Moderna vaccine starting the week of March 22nd. I estimate that we are about 85 to 90% completed with the 1B phase. Too early to estimate the 1B plus phase. And then she goes on to say that the governor has not determined when phase 1C will begin. The larger counties are just finishing the 1B phase, and some are just starting with 1B plus. We have to wait until they catch up with the smaller counties before we will open phase 1C. So I think maybe that's changed now. There's kind of some-
With the governor's directive yesterday afternoon, yeah.
So, and that was what Teresa had to say.
Okay, are there any other reports from anyone?
I just had this dovetails into the water wells. Does the county have any recommendations for child fluoride treatment for young kids?
No, I mean, we don't give anything like that.
Well, the city has the fluoride in the water, and I was talking with Diane this morning because I have some people that have concerns about that and had their water tested and showed no fluoride, of course.
Right.
But is there any recommendations?
We don't have recommendations. I know because I was on well water that our dentist told us for our kids to start using ACT
Yeah.
as a mouth rinse
Yeah.
to do that.
Yeah. Maybe we should, I'm talking to Teresa next week, and maybe we can kind of come together with something that we can put out to the
Just
out to the county.
public
Because,
service
like I said,
announcement.
look how many people are coming in. A lot of people take water for granted. They don't know
They
what
won't
the water's
understand
quality is going to
anything.
be, how deep it is, what's in it,
Yep.
And okay.
Yeah, I mean, that's definitely something that we can work on, and I can issue I can put something in with my septic permits when they go out.
Yeah, just
as
a
well.
little, your children, if you have
little
children,
blurb.
they want fluoride.
A little bright
Yeah, something.
something to go with it.
Yeah.
The only issue, I mean, we can absolutely do that, and I think it's a great idea. The only issue I see is that we have spec home builders, that like the one came in today with 10 permits.
Yeah.
That probably won't get passed
Yeah.
on to the actual
Yeah.
homeowner. So we will need to do a varied approach to get that out there.
Yeah.
So, yep. That sounds good.
Any other reports, questions? Okay, seeing none, I guess we will adjourn at 1:26.
Oh, let me just make sure there weren't any comments.
Oh, there aren't. I've been looking.
Oh.
There aren't.
Unless there's something in there. Nope.
I kind of glanced. So, okay.
Thanks, folks.
I work at my full-time job is doing,
That's what we're supposed to do.
at the state.
That's all.
Yeah.
One night lanes.